Welcome, everyone. My name is Samir Kakodkar. I'm a gastroenterologist and specialist in ulcerative colitis and Crohn's disease. Welcome to Against the Grain. Please do check out the rest of my podcasts, which can be found at the website samir3.podomatic.com. It can also be found on YouTube or Spotify by searching my first and last name. For those who are interested in contacting me regarding questions or for virtual appointments, my email is samir3@gmail.com. On Facebook, you can search for the Against the Grain private group for ongoing discussions about these podcasts. You are likely listening to this because you have recently been diagnosed with inflammatory bowel disease, either ulcerative colitis or Crohn's disease, which I will reference as IBD. You may have heard of IBS or irritable bowel syndrome before, which is more common, but IBD is different from this, and we'll go over what IBD is in more detail during this podcast. I may have been the doctor who diagnosed you and told you to listen to this podcast, or maybe you sought a second opinion from me or found me through my other podcasts, which I encourage you to check out. In any case, this podcast is a great place to start before you go on the internet and start Googling these conditions without any direction. My goal is to give you sound, rational, evidence-based advice on how to manage these conditions so you can live a normal life, or as close to a normal life as possible. I am a gastroenterologist and specialist in Crohn's disease and ulcerative colitis. So what does that mean? In addition to the standard medical training to be a GI doctor, I did an additional year of advanced training in IBD. I am board certified in internal medicine and gastroenterology. I have also been in the same position you are in now. I have IBD myself. It has been called both ulcerative colitis and Crohn's disease in the past. For many years, I have managed it successfully. Knock on wood, I have never required hospitalization or surgery and work full-time in a busy practice. I did this by using a combination of dietary changes and medication, which is what I hope to help you do as well. I have spent more than 10 years doing research within academia regarding diet as a treatment strategy for IBD. Nobody controls or has any influence on what I say except me. As a policy, I don't take any money from pharmaceutical companies, so I can remain objective and free of influence. The only money listed online about me was the salary I earned during my IBD fellowship training, which I only learned after graduating was provided by Pfizer as a grant to Northwestern. I was specifically told that this does not qualify as a conflict of interest for me. To break it down to the basics, what is IBD? IBD means you have inflammation in your GI tract. Inflammation means redness of the tissue, swelling, and ulcerations. This is caused by your immune system inappropriately attacking that part of your body and or the bacteria or potentially fungi that live there as well. Now that you know you have this condition, my first word of advice is don't panic. Take a deep breath. Maybe you know a friend or relative that has had a bad case that required surgery or needed a bag on the abdomen. That doesn't mean this is going to happen to you. About 20% of patients with ulcerative colitis and 80% of Crohn's ultimately need surgery at some point. I am someone who has had Crohn's for more than 10 years and did not require surgery, so it is possible, and I believe potentially avoidable if you do the right things and take this seriously. There are many things that I will outline today to help potentially prevent you from needing surgery. You may have a case that already needs surgery, and if so, it's not the end of the world. Most people feel much better after getting surgery and live a normal life. Let's first briefly talk about what may have caused your IBD. Unfortunately, we don't have a complete explanation. It's some genetic predisposition combined with an unknown or yet to be identified environmental trigger or set of triggers. Over 200 genes have been identified that have been associated with developing the disease, and the key word here is associated. It's not necessarily causing it. Most of these genes have to do with the functioning of the immune system, such as sensing bacteria or a process called autophagy. It may be that some of these genetic variants offered advantages to your ancestors thousands of years ago to fighting certain kinds of infections. Now that we live in such a hygienic environment where everyone lives indoors most of the time with indoor plumbing, your immune system may have gotten bored and is rebelling. Unless you have multiple family members with IBD, I don't think genetics explains most of the new cases of IBD out there. I view the Western diet as a more significant cause. This means the diet we tend to eat in the US, Canada, and Europe, where IBD is more prevalent. And now the Western diet is sweeping the globe, which explains why you can find IBD almost everywhere. This dietary pattern tends to be higher in processed foods, which are things like cookies, cakes, candies, crackers, ice cream, white pasta, pizza, frozen dinners, fast food, processed meats, and dairy. These are foods that tend to come prepackaged and, though maybe easier to prepare and eat, could be harmful to your health. They can have added ingredients that are known to mess up the bacteria in your colon and damage the gut barrier. Processed foods also tend to be low in varieties of plant fibers, which ultimately are the food source for good bacteria in the colon. There have been theories put forth that specific types of bacteria may be the cause of Crohn's disease. For example, there are some researchers who believe some cases of Crohn's disease may be caused by a particular bacteria called Mycobacterium avium paratuberculosis, which comes from infected cows, but is also just in the environment now, in the food supply and in the water. Other factors that can contribute to getting IBD include having a low vitamin D level. Vitamin D is involved in immune system functioning, and exposure to antibiotics in childhood. Contrary to popular belief, there isn't much evidence that stress causes IBD or makes the inflammation worse. However, in individual cases, I do believe it can be a factor. Now that you have the condition, you need to carefully consider what your goals are regarding managing it. Your main goal, in my opinion, should be to have the best quality of life for as long as possible. Life is short, and you need to live as well as you can to the fullest. If your goal is to cure your IBD without the use of medications, I don't blame you. This seems like a reasonable and rational goal, which is very common amongst newly diagnosed patients, especially those that are relatively young and perhaps never had any other medical problems before. Realistically, this does require some kind of medication in most people, though. Again, I am not saying this based on any influence the pharmaceutical companies have over me. Believe me, I still dislike Big Pharma. At the same time, their medications are tools to utilize to help you feel better, and they have the best research proving they can work. Don't get me wrong. There are people out there with IBD who are able to manage their disease with changes in diet and lifestyle alone. I have done some podcast interviews with such people, and you should check them out too. However, these are anecdotes and rare cases. In my clinical experience, the probability of having a great quality of life with this approach is low. I would estimate this is likely less than 10% of patients in the real world. There are many dietary protocols you can find online for Crohn's and ulcerative colitis. I spent much of my research career studying these diets. I have also personally tried following the specific carbohydrate diet, the inflammatory bowel disease anti-inflammatory diet called ibd-aid for short, and the whole food plant-based diets. In my case, I have felt the best when on both medication and diet. I don't think patients do that well in most cases when trying to take medication alone or just changing diet without doing both at the same time. As of right now, I generally recommend either the specific carbohydrate diet or ibd-aid for Crohn's disease and the whole food plant-based diet for ulcerative colitis. For both conditions, being more plant-based is probably helpful, though I think Crohn's disease patients tend to be more grain sensitive and ulcerative colitis patients more meat and animal dairy sensitive. For those who feel these strict dietary protocols are unrealistic to follow long term, I then suggest the Mediterranean diet, which is probably easier to follow and may have similar efficacy. For more details, please listen to my other podcasts dedicated to these diets. The bottom line with most dietary protocols is that they tend to take out processed foods and also are relatively plant-based, some more so than others. Plant-based means trying to avoid eating too much meat and animal-derived dairy. That is what I recommend at minimum, but ultimately changing your diet is optional but strongly encouraged. Some patients do just fine with medication alone, but not most in my experience. You also have to realize the downsides of a strict diet. If you are someone who considers yourself a foodie or you live to eat, then this may not be the strategy that ultimately leads to a better quality of life. It can also interfere with your social life and traveling. This especially applies to the more strict dietary protocols. I intimately understand the psychology of being diagnosed with IBD. This is a relatively rare condition, occurring roughly in 1 in 500 people. When something rare happens to you, you start to believe that everything rare is going to happen to you, which is not true. The risk of you getting a side effect to a medication is completely independent of all the other rare things that may have happened to you in the past. The FDA would not approve a medication if lots of people were getting severe side effects to it, although I acknowledge there have been rare exceptions to this with medications that have been pulled off the market after the fact. I often see patients who are terrified of certain medications that have a less than 1% risk of side effects, yet they comfortably drove to the clinic appointment. Driving has a much higher risk of dying from a car crash. For example, if you feel like you are definitely going to get lymphoma by taking Humira or Remicade, that is not true, and you are not thinking rationally. The risk of that is minuscule, approximately 1 in 2,500. I think part of this fear is not being in control of these potential side effects once a medication is started, and I get that. I also have felt that fear and sympathize with it. You also need to understand there are safer medications approved now that are not associated with any risk of cancer or serious infections so far, such as Entyvio, Stelara, or Zeposia. If you are particularly afraid of side effects, these medications are great options, but it really depends on if your insurance will approve them. There are also patients who feel like they are giving up if they start a medication. That is surely not the case. Again, the goal is to regain your quality of life, and you need to optimally utilize all the tools at your disposal. Some patients are uncomfortable with medications, especially the injections or infusions, because they feel like if they start it, they will never be able to get off it. Again, the priorities are a bit off here. That would actually be ideal, and often in reality doesn't happen. It would be great if you were on a medication that kept the IBD in remission for the rest of your life and you didn't have any side effects. I tell my patients that they are always in control. I can suggest continuing the medication long term, but I can't force you to get the infusions or injections. If for any reason you want to stop it, that is completely up to you as long as you understand what likely will happen afterward, which is a flare. You can think of the management of IBD to be similar to the management of high blood pressure. The medications help to bring the blood pressure down, but you will develop high blood pressure again if you stop the medications. I've been on multiple medications in the past that worked perfectly and tried to go off of them thinking I could maintain remission only with diet. Guess what? It didn't work out despite me being an ideal candidate for stopping medication every time. If you are anything like me, the first thing you may want to do is Google any medication that may be suggested for you and find out everything you can about it. However, this often leads you down a rabbit hole of online forums where you mostly encounter people who have had bad experiences with that medication or it didn't work. This may lead you to believe you will have a side effect or the medication won't work for you. The people who are doing great on the medication and having no side effects don't usually post as much on online forums, so you are seeing a biased sample. I see plenty of people who are doing great long-term on medication in my practice. I want to reassure you that the great majority of my patients who go on any of the IBD medications I prescribe tolerate it well. Most of the time I am able to find a medication that does end up working, but it can be a trial and error process to find the right one. In the future, we may have better tools to figure out the ideal medication for you based on your biology and what is specifically causing your inflammation. We are not there yet, though. I encourage you to seek an opinion from someone specialized in IBD like myself so that you are started on the optimal medication from the start, according to the most up-to-date research. The first medication you take is the one most likely to work, so it is especially important to get that right from the start. You also need to understand that sometimes steroids like prednisone are recommended to get the disease under control quickly. This is a steroid that is a pill. This should not be used long term, ideally just for a few months at the very most. The reason for this is that side effects will happen if these are taken for a long time, including things like osteoporosis, diabetes, cataracts, problems with the adrenal glands, anxiety, depression, acne, and many other things. That is another major goal in IBD care. Try to keep the steroid use to a minimum and definitely not long term. The injections and infusion medications and some newer oral medications can allow you to get off the steroids and are safer to take long term. I recommend you see an IBD specialist, go on the right medication, and change your diet. At minimum, take out processed food and try to eat more plants. If you have a stricture or narrowing in your bowels, chew your food well to liquid or pureed consistency before swallowing, and avoid things like asparagus, celery, and popcorn, which could get stuck within those strictures. If you are an overachiever, I suggest a specific carbohydrate diet or ibd-aid for Crohn's and whole food plant-based diet for ulcerative colitis. Mediterranean diet, again, is also a less restrictive option for both. Neither diets nor medications are cures for these diseases. Most of the time, you need to maintain both in order to feel optimal. In my experience, it is nearly universal that a flare will happen eventually if you stop your medication. It may be immediate, a few months, or even a few years later, but it most likely will come back. Are there exceptions? Sure, I have some of these kinds of people in my practice, but this is very rare. Remissions maintained by diet alone tend to be fragile, and any little thing can set off a flare, such as getting food poisoning or even an upper respiratory infection. Again, I say this from experience. I've been an optimal candidate for stopping medication at least twice already, and tried stopping the medicine while maintaining a strict diet, and there was inevitably something that would set me off. Now I'm back on medication. You may also be tempted to go online and look for so-called natural cures for this condition. These can include a whole host of things, like low-dose naltrexone, manuka honey, cinnamon, slippery elm, aloe vera juice, wild oregano oil, probiotics, bee propolis, parasites, kangen or alkaline water, boswellia, vitamin, mineral, amino acid supplements, or laying in the sun all day. I have tried most of these natural treatments and have a whole drawer full of old bottles, but then came to the conclusion that they did nothing and were a waste of time and money. You may be familiar with the infamous infomercial snake oil salesman Kevin Trudeau, who published a book called Natural Cures They Don't Want You to Know About. Well, if I am the they in this title, I can honestly tell you I am not aware of any natural cures that are effective, safe, and easily accessible to most people. I have seen one case of ulcerative colitis go into remission with a probiotic called Visbiome, but many more cases that had no response to that. Apart from that one exception, I've yet to meet a patient who had objective evidence of healing IBD using any of these therapies. Often patients who claimed they didn't get any other testing to prove that they had healed their colon, or are doing other things like diet or are on another medication. Some argue that they may offer some marginal benefit in addition to other therapies that is not noticeable, but I would argue that if it's not noticeable, it's probably not worth wasting your money on it. Also, if you read reviews for herbal products or diet books online, keep in mind that this is one snapshot in time. IBD symptoms can change, so a declaration of a cure one day may not hold up a couple years later. But how often are these reviews actually updated? I think I still have one of my reviews of the book Breaking the Vicious Cycle by Elaine Gottschall going over the specific carbohydrate diet. It's still up on Amazon, and I didn't update it myself, so that's very much outdated. One mistake I have observed over and over is the IBD patient in remission with the insatiable desire to add more and more things to his or her regimen. For example, one may say, I am feeling completely normal on my medication and diet, but I heard hookworm therapy, ice baths, and low-dose naltrexone are helpful, so I'll add them in as well. Most of the time, this is a bad idea. You'll end up with a large list of supplements and activities that most likely are of no or marginal benefit. First rule of IBD: if something is working, enjoy it, and don't mess around with success. The only exception to this is people leaning too hard on medication and not changing the diet. I don't think people should be too comfortable in a medically induced remission because long-term for most people this doesn't work out. Boost your chances by changing the diet too. I do utilize something called exclusive enteral nutrition in my patients with Crohn's disease. It is an alternative to steroids to get things under control. It involves drinking formula only with no other food. For example, I tend to use Ensure Plus, but some people like Kate Farms. I've done this myself at times to avoid steroids, and it is extremely difficult. But for the particularly motivated patient, can be a valid treatment strategy to get things under control without side effects. This only works for Crohn's and not for ulcerative colitis. A word of warning. If you already have deep ulcers, severe anemia, fistulas, or strictures in your bowels, I strongly suggest you get on appropriate medical therapy right away and don't waste time. These are signs of aggressive disease, and surgery is inevitable if you don't start medication. And even with medication, there's no guarantee. You will not have success trying to manage this kind of Crohn's disease with diet alone in the vast majority of cases. I am sometimes comfortable using diet alone to treat IBD, but this is really just with mild disease. If you are listening to this and think you have been cured by anything other than diet or medication, please email me. I may want to interview on my podcast. I am open-minded, but will ask for proof with a colonoscopy demonstrating healing of the bowel. Just like you, I hope one day there is a way to cure these diseases, so we are not so reliant on medication and surgery. There are a few things I think every IBD patient should know from the outset. If you have any issue with minor aches and pains or headaches, don't take ibuprofen, Aleve, Motrin, Naprosyn, or Celebrex, or even aspirin. These medications are called nonsteroidal anti-inflammatory drugs and sometimes can make IBD worse or trigger flares. Tylenol should be okay to take instead. If you are prescribed aspirin for your heart health, it is okay to take and shouldn't cause any problems. Although some recent research suggests that nonsteroidal anti-inflammatory drugs may not be as harmful as once thought in IBD patients, I still think on an individual basis they can cause problems, so it's generally a good idea to avoid them if possible. From time to time, your GI may recommend that you get either a stool test, imaging study like an MR enterography, which is a type of MRI study, or colonoscopy. You may wonder why this is necessary, especially if you are feeling normal. We are trying to do screenings for colon cancer and also make sure the medications and or diet you are on are working. If you stay on a treatment that is not working, you risk long-term damage to the bowel, like narrowings or fistulas that may require surgery if not addressed early by changing therapy. It's also important to know that your symptoms are not particularly reliable to determine if you have active inflammation going on or not. I have done colonoscopies on plenty of patients who felt completely normal, and when I do the scope, I can see a stricture or narrowing in the bowels forming. I have also done scopes on patients screaming out with symptoms, and everything ends up looking normal. So objective evidence here is the key. If you are not already seeing a primary care physician, I highly recommend you do, because they can keep track of the preventive care you will need going forward. There are multiple vaccines that are recommended when you have IBD and are immunosuppressed. You also sometimes will need to do studies to screen for osteoporosis and also get pap smears yearly to look for cervical cancer if you are a woman who is immunosuppressed. Everyone with IBD, no matter what medication you are on, is supposed to see a dermatologist for skin exams due to the very small increased risk of melanoma, no matter what medication you're on. I always recommend people check out my full catalog of podcasts. If you listen to all of them, you will have a deeper understanding of your disease. I do want to give some brief comments on the podcasts I've done already to address many of the similar types of questions I get about them. My first two podcasts were titled When Nothing Works, and then the follow-up to that was When Nothing Works, Surgery Can. This followed a friend of mine who was diagnosed with ulcerative colitis and tried everything you can think of before deciding to get surgery. And the second part is his perspective just after getting surgery, and his quality of life greatly improved. As an update, he is doing well and does not regret his choice to get surgery one bit. He still does have his ostomy in place and decided against getting a J-pouch for now. I want to make sure everyone knows that my decision to do a podcast with someone does not mean that I endorse whatever therapy that is being discussed. These are just discussions meant to encourage research into these topics. So far, the small number of patients that have tried whipworm, hookworm therapy, circadian rhythm, sun therapy, Ayurveda, cannabis, low-dose naltrexone, baking soda, or fecal transplant for IBD without changing either diet or going on medication have not had success. Perhaps I'm seeing a biased sample of patients who are not doing well. Hopefully, we have better research studies in the future about these treatments, but they're not ready for prime time. I also want to make it clear that I neither endorse nor recommend anybody try fasting for IBD. I still consider this dangerous when done for several days at a time. I tried fasting myself and after a week ended up hospitalized with pneumonia. Don't do it. There is a research study ongoing now studying a fasting mimicking diet, which may be a safer option if it proves to be effective. Let's wait for this data to come out. So to summarize, I want to go over my simplified prescription to treat IBD. It's really not that complicated to know what to do. Number 1, start with appropriate and optimized medical therapy, preferably by an IBD specialist like myself. Number 2, if this works, follow an IBD diet protocol that speaks to you and that you can realistically follow long term. Bottom line is to take out processed food, and being plant-based is probably helpful. Number 3, after at least 1 year, if in deep remission, meaning you're feeling completely normal with normal colonoscopy, normal biopsies, continue the medications if you're not having any side effects. Or you could also consider stopping the medication or reducing the dose and continue the diet with careful monitoring strategy for recurrence. If there is disease recurrence, restart medical therapy at the direction of an IBD specialist and consider changing your dietary protocol. If you run out of medical therapies or are stuck on steroids like prednisone, surgery is a good option, which can not only save your life, but improve your quality of life. Besides diet and medication, other complementary and alternative therapies like supplements and probiotics are unlikely to be the miracle you hope for. So, to close, I am producing and funding this podcast completely on my own and would like to keep it that way. I don't have any sponsors, and I'm trying to rely on support from listeners. At this time, I'm really only able to do medical appointments with people who live in Illinois, and I can either do virtual appointments or in-person clinical appointments. My clinic is located in Niles, Illinois. The phone number to call to schedule an appointment is 847-318-9595. If you live outside Illinois, elsewhere in the U.S., or even around the world, you can actually book a 30-minute phone conversation with me for those of you who want more personalized attention. The website to go to schedule that appointment is https://calendly.com. That's calendly.com/Samir3. That's SAMIR3 /against-the-grain. You can also see this link on my Facebook group if you'd wish to join that, the private Facebook group, or under any of the YouTube videos that I've posted. That link will be there for phone conversations. Any proceeds I get from that will help to continue to host and produce this podcast. So thank you for listening, and I hope to speak with you or see you in person soon.